am Dr. Nivedita Kaul, Consultant Obstetrician and Gynaecologist at CK Birla Hospital, Punjabi Bagh, New Delhi. Today I shall be discussing with you a very important topic related to birthing, related to delivery, and that is postpartum bleeding or postpartum hemorrhage or PPH. This is one of the complications related to childbirth which we gynecologists dread the most. That's because this complication can be unpredictable. It can evolve really rapidly and progress, leading to a potentially life-threatening situation for the mother. So in the next few minutes, we shall be discussing what is postpartum hemorrhage, what causes it, what are the risk factors which predispose a lady to having excessive bleeding after delivery, can it be prevented, and how do we manage it if it really occurs. So first, let's talk about what is postpartum hemorrhage. Postpartum hemorrhage simply means excessive bleeding after delivery of the baby. This can occur either following vaginal delivery or after a cesarean delivery. So we know that normally after delivery a woman bleeds. Now this bleeding arises from the uterus or the womb. In fact, the bleeding arises from an area in the womb where the placenta is attached during pregnancy. The placenta is the organ. In fact, it is a bag-like structure full of blood through which the blood from the mother reaches the baby and supplies the baby with food, oxygen, nutrients and water. So after delivery, once the baby is expelled, the placenta is no longer required, so it separates from the wall of the uterus, and following the placental separation, bleeding starts to happen from that area where the placenta was attached. Normally, as soon as this bleeding starts, nature's protective mechanisms kick in and the uterus starts to shrink, squeeze or contract rapidly so as to stop this bleeding, and within a matter of seconds or minutes, the bleeding reduces significantly. However, sometimes nature's protective mechanisms fail to kick in. Because of that, there is continuous bleeding and blood loss from the placental site. This in fact is the commonest cause of postpartum hemorrhage, and that is the failure of the uterus to squeeze rapidly enough following the delivery of the baby, allowing continuous bleeding from the uterus. Postpartum hemorrhage or excessive bleeding following delivery can also occur because of some injuries or tears or lacerations in the vagina or cervix that may happen during childbirth. It can also occur due to some pieces of placenta or membranes that may be left behind or retained inside the uterus. But the commonest cause of PPH is failure of the uterus to contract following delivery. The uterus loses its tone, becomes bag-like, and that's why it's called atonic PPH. So whenever a patient is bleeding excessively after delivery and the estimated blood loss is in excess of 500 ml or half a liter, we say that the patient is experiencing PPH or is having the complication of postpartum hemorrhage. It is said that up to 5 out of 100 women can experience this complication or may experience this complication after vaginal delivery, and the chances can be slightly higher following a cesarean delivery. In fact, excessive bleeding after delivery remains the most important cause of maternal death related to childbirth in developing countries. With this, I say goodbye and good day to all of you.